Good morning. A warm welcome to the learned chair, presenters and delegates to the poster presentation session on 9th December. The theme of today's poster presentation is Case Reports, Observational, Pragmatic and Randomized Control Trials. Dr. George Matthew, to please introduce the chair for this session.
Thank you, Dr. Anu. Today we are supposed to have 3 chairs. We have with us at present Dr. N. Mohandi, Professor Dr. Niranjan Mohandi, who is the Director of the International Study and Research Center in Homeopathy. And we hope that we'll be joined by Dr. V.K. Chauhan, former Principal of B.R. Sur College and former Professor in Medicine and Pediatrics at Nehru Homeopathic Medical College and Hospital. And we are also supposed to be joined by Dr. Yon Wok, who is an MSc Epidemiology and Biostatistics. She is the member of the Editorial Advisory Board in the Indian Journal of Research in Homeopathy, published by CCRH, and also the Assistant to the President, Living Homeopathy Limited, Hong Kong. So I welcome all the chairs to the session, and I hand over to Dr. Anu to invite the speakers.
The first speaker for today's session is Dr. Richa Verma. She'll be presenting her experience on a case of migraine. Dr. Richa.
Just a word before the speakers start. Please see that you stick to your prescribed time limit of 7 minutes. And when you're not speaking, see that you are on mute and videos are off. Thank you.
Respected coordinators and delegates, a very good morning to all of you. This is Dr. Richa, going to present a poster on the topic, prospective randomized study to compare the effect of Bacillus morgan batch and Natrum muriaticum in cases of migraine. Aim and objectives: to compare the effect of Bacillus morgan batch and Natrum muriaticum in treatment of migraine by using visual analog scale VAS, and to assess any new clinical symptoms if obtained. The introduction is: headache is frequently encountered neurological symptom characterized by a feeling of discomfort or pain. Around 90% of patients suffering from headache are of primary type. Primary headaches are those headaches which have no organic basis. And out of this, large number of patients are suffering from migraine. Migraine is the most common cause of vascular headache. A useful definition of migraine is a benign and recurring syndrome of headache, nausea, vomiting, and other symptoms of neurologic dysfunction in varying admixtures. It can often be recognized by its activators like red wine, menses, hunger, lack of sleep, glare, estrogens, worry, perfumes, letdown periods, etc. And its deactivators like sleep, pregnancy, exhilaration, and sumatriptan. The methodology is the study, a prospective randomized study, was conducted at Dr. MPK Kuteta Homeopathic Medical College, Hospital and Research Center at Jaipur. And 70 cases were enrolled in the study. Out of these 70 cases, randomly selected 35 cases received Bacillus morgan batch, that was group A, and 35 cases received Natrum muriaticum, that was group B. VAS scale was used to assess the improvement in the study. Results. After comparing pre and post-treatment scores, a pair T test was conducted to compare before and after score of group A, that was Bacillus morgan batch, and Natrum muriaticum group B in cases of migraine. After study, it was seen that there was a significant difference in scores for group A, Bacillus morgan batch, before mean 8.17 and standard deviation 1.014, and after scores mean 3.43 and standard deviation 1.57 with T value 19.4, and scores for group B, Natrum muriaticum before Mean was 8.29 and standard deviation 1.100, and after values mean 1.23 and standard deviation 0.9 with t-value 36.74. There is comparatively more improvement in migraine with the natrium muriaticum than Bacillus morgan. After this study, it was concluded that natrium muriaticum is more effective than Bacillus morgan in the management of migraine. It is also showed that migraine is commonly occur in females than in males, in the middle age group, and in low socioeconomic status. This study will helpful in enriching to the existing literature of materia medica on bowel nosodes. Although it can be concluded from the study that natrium muriaticum is more effective than Bacillus morgan in managing the cases of migraine, but further studies with bigger sample size and longer follow-up are necessary, so that it can provide advantage into clinical practice. This graph is also showing that natrium muriaticum shows better results than Bacillus morgan in this study.
So, what was the objective of this study? These two type of case. What are the symptomatology taken for this intramine, and what are the symptom taken for?
Sir, although the symptoms of both the remedies are similar, but there are some different symptoms which was present in Bacillus morgan, like the congestion. The congestive symptoms are more present in Bacillus morgan group, Bacillus morgan batch. Although there are many common symptoms in these two remedies, like the natrium group, natrium muriaticum is introvert, Bacillus morgan is also introvert, and both have associated symptoms like vomiting and nausea before the headache. But the main symptom which is different in Bacillus morgan is congestion, and the key feature of Bacillus morgan batch is also congestion.
So did you included the physical general, mental general more than the particular symptom?
No.
When you read of totality, it was on totality basis also prescribed seems to be. So what was the basis of that totality? Was it a mental symptom, physical general, characteristic particulars, or it was something else?
Sir, actually, I used to take more particular symptoms in this study. More pathological symptoms I used to take.
So how you diagnose? What are the diagnostic tool you use to come to confirmation that it is a migraine?
Sir, the symptoms only, like the scale which was used, VASCAL, and the symptoms like in migraine with aura, there are symptoms like nausea, vomiting, flickering before eyes, blindness, and the accelerated symptoms like what are all modalities which can increase the pain and all, like menses, lack of sleep, hunger and all.
Okay.
So I invite
I pass on to Dr. Matthew. I pass on to Dr. Matthew now.
So I will have a reminder for both the chair that you have to grade the poster on a scale of 1 to 10. Assess the poster.
Yes, I have assessed, but how to give it? It is enough. Afterwards, I will give it. Afterwards, I will give it. After finishing everybody's.
Yeah, you can keep your assessment, I think, yourself. I'll invite Dr. Yon Wok for her remarks.
Thank you for your presentation. Dr. Richard, I would like to highlight a few things that is of very important, because this this presentation, you categorize it as a randomized control trial, and I think we need to know what are the basic elements from a randomized control trial. First, if you are prescribing according to the indication of the symptom picture, then it is not possible for you to randomize the patient.
Yes.
Right. So this is one of the things that we have to, you cannot rationalize the whole thing if you are randomize it and prescribe it according to indication. So this is number one. Number two, if you're talking about randomized control trial, we need to compare the baseline demographics of two groups. Okay, because after randomization, if you want to prove to others that it is a real randomization, we need to show the basic characteristic comparison, right? Okay, the third thing is what is the dropout rate? What is the follow-up compliance? All this we need to compare. And fourth, this kind of result is not presentable because a pair t-test is not used in this way. If you use a pair t-test to compare the pre and post treatment score, the conclusion can only be drawn within that group. But your conclusion is drawing, the conclusion you're trying to draw is the comparison between the two groups. Okay, a pair t-test is not sufficient for you to draw such a conclusion. If you want to draw such a conclusion, you need to use independent t-test to compare the post score of the two groups, right? And yeah, those are the, and concealment is not mentioned in the poster as well. All these important elements of RCT are not included in the poster. I think these are the essentials if we want to perform an RCT or if we want to report that RCT. Otherwise, it will not meet the standard of the RCT.
Ma'am.
Yeah.
Ma'am,
I hope we can interpret. Yeah.
Ma'am, the symptoms of the both these remedies are almost similar. There is only a difference of only one symptom like congestion and all. So we used a random number table method for randomization randomization of the cases, and we give the remedy to the cases according to the random number table method. And
so the prescription is not based on symptom picture; it is based on randomization, right?
Yes, ma'am.
Yeah, and it is contradictory to your answer to Dr. Mohati.
And ma'am, one more thing that by mistake I didn't mention that we also conducted a independent t-test also in the study, pair t-test and independent t-test both. After that two tests we conclude this result. I think by mistake I didn't mention in the
yeah you should have included that. Yeah, otherwise it would be very confusing.
Yeah. We conducted both tests, unpaired t-test and pair t-test, pair t-test for the comparison of the intergroup and unpaired t-test between the two groups. I think by mistake I didn't mention in this poster.
Yeah.
And for randomization, we use a random number table method to give the medicine.
Thank you.
Thank you, Dr. Richa. Now I invite the next speaker, Dr. Mallika Batra, to explain her case series on tension type headache.
Ma'am, I'm unable to share my screen. Yeah, now I can do it.
Okay.
Is it visible?
It is.
So good morning to everyone. The title of my poster is A Case Series on Effect of Homeopathic Treatment on Tension Type Headache Arising Due to School Stress. So as we know, tension type headache is one of the most common headaches that we find in children. And according to the International Classification of Headache Disorders 3 criteria, it is classified as a tension type headache if the episodes are more than 10 in a year, they are bilateral, they have a pressing, tightening quality pain, they're of mild to moderate intensity, and they're not aggravated by any physical movement. So out of these 4 characters, at least 2 of them have to be present, and the episodes should last more than 30 minutes. Usually the episodes are not associated with any nausea and vomiting, but photophobia or phonophobia, any one of them may be present. So tension type headaches have been called by different names in the past: stress headache, ordinary headache, cervicogenic headache, but the main risk factors till date remains stress. And in particular case of children, where they spend a major part of their day at school, the stressors at this front contribute largely to the appearance of headaches. So the stresses that they face can be increased academic challenges, pressure to perform well at school, weakness of memory, bullying by peers, or being treated unjustly by the teacher. And in this case series, we have included 6 cases that developed tension type headache after such stressors, and they were assessed using the hardship questionnaire, which is the headache attributed restriction, disability, social handicap, and impaired participation questionnaire, of which the child and adolescent version was used. And the impact and the quality of life scores of this scale were used. And none of these cases were given any conventional or the modern medication during the course of treatment. So we aimed to ascertain how these cases responded to homeopathic treatment. And we had taken 6 cases, which were in the age group 6 and 17 years of both the sexes. They were diagnosed according to the ICHD3 criteria, which I mentioned. And in the background, they had these school stressors. All these cases were followed up for a period of 4 months, and the follow-ups were done at a monthly basis. And all of the impact scores and quality of life scores were also noted at the baseline, at every follow-up, and at the end of treatment. So I will go quickly through all the case summaries. So case 1 had headache since 3 years. There was also a history of getting bullied by his peers in the school. The headache was bilateral. It was aggravated on skipping meals. There was heat in the eyes along with headache and aversion to meat. The prescription was lycopodium 30 followed by placebo, and on follow-up 2, lycopodium 200 was prescribed. The scores of both the impact and quality of life at the baseline and final have been indicated for each of the cases. Case number 2 had headache since 2 years. The location was whole head. It was a dull pain and aggravated on studying. It was ameliorated by tying something around the head. Along with that, there were cramps in the wrist, which developed since 1 month. So the patient had headache since 2 years, but the episode started increasing since the last 1 month, wherein she developed cramps in the wrist while giving her examination, and she went blank during her exam. And she could not recall all what she had memorized and kind of had a brain fag situation. And since then, she developed a fear of failure in exams despite scoring well. So picric acid 200 was prescribed to her, followed by placebo, and prescription was repeated on follow-up 1. In case number 3, the patient had headache since 4 months. It was in the forehead. It was aggravated when skipping meals and around midday. Along with that, there was a weakness of memory, and the child reported that she had difficulty to understand things quick enough. She would take time to understand concepts. She also had fear of being alone, and there was a desire for eggs, spicy food, and sweets. Her sleep was unrefreshing. And along with that, there was coldness of feet in bed, which was reported. So she was prescribed Calcarea carbonica 200, followed by placebo. And for an acute episode of headache on follow-up 3, belladonna 30 was prescribed. Case number 4 had headache since 1 year. It was in the whole head. It was a typical band-like pain, and which was aggravated on studying. So the child developed headache after there was a change of school. He had inability to understand mathematical concepts, and which is why the parents decided to change the school for him, but it did not help. In fact, it brought on his headache episodes. Along with that, there was desire for cold drinks, and phosphoric acid 200 was prescribed, followed by placebo. Case number 5 had headache since 2 years. It was a throbbing pain in the occiput, which was aggravated on studying and ameliorated by cold application on the head. And again, there was a pressure to perform well at school by the parents and the teachers, and Calcarea carbonica 200 was prescribed. Another symptom was that she had a desire for sweets, especially during the headache attacks. Case number 6 had headache since 2 years, and it was a left-sided band-like sensation. It was again aggravated in the morning. There was intolerance to meat, and along with that, there was a weakness of memory, and she could not memorize things in school, which is why the teacher would hit her. And she was a very timid child, would take a long time answering and would avoid answering in class. And Baraita Parbonica 200 was given to her. If we see the results in figure 1 and 2, the impact and the quality of life scores of the questionnaire have been mentioned for each of the cases in all of the follow-ups. And we see that there was a marked reduction in the impact scores along the course of treatment, with a subsequent increase in the quality of life scores in all of the cases. And with this result, and along with the changes in score, the headache frequency, intensity, and pain duration also decreased, which does give us a good starting point to base future large-scale studies. Thank you.
I'll invite the chairs to give the comments.
Oh, hello, am I audible?
Yes, yes.
So what were the taken inclusion and exclusion criteria for all these?
Sir, the age group was decided that the cases were between the age group 6 and 17 years, and they were diagnosed according to the ICHD-3 criteria of the tension type headache which was given, and they would have this school stressor as a background in their history. So this was the inclusion criteria.
No diagnostic criteria. Other diagnostic too. There are so many diseases resembles like headache, tension headache. How
Yes,
you
sir.
excluded them?
So they were diagnosed according to the International Classification of Headache Disorder criteria, which says that there should be at least 10 episodes in a year. There should be greater than 30 minutes, and the pain should be of a bilateral, either of the two of the following 4 characters. That it should be bilateral, it should be of mild to moderate intensity, of a pressing tightening quality, which is a non-pulsating pain, and it is not aggravated by any and there should be no nausea and vomiting, and along with that photophobia or phonophobia, any one of them can be present.
Oh, very nice, thank you. You tell me one point.
Yes,
you took case and only prescribed 1 or 2 drops. With that it was really improved?
Yes, sir, yes, sir, there was
because in a long-standing chronic disease, it might be requiring lot of treatment also. But you have shown you are confident of that.
Sir, the follow-up duration was
that?
Yes, sir. So the follow-up duration was only for 4 months. So if that is also a limitation of the study, that if we would have followed up for a longer period of time, we would have needed more prescriptions and we would have got better results and would have a clear picture that how the cases progressed and whether there were any relapses or not.
Okay, thank you.
Thank you, sir.
Ma'am, I invite Dr. Jan Walk to give the comments.
Thank you for the report. And yeah, I think it is a very nice report. And just a little thing to add, if you are going to publish it, it would be even better if you can give the Monarch score for all the 6 cases that you have. Yeah, I think it would add a flavor to the audience that how likely those cases are due to the remedy or the treatment process, and it would add further weight into your statement. And I think overall it is a very good presentation. Thank you.
Thank you, ma'am. I'll consider it. Thank you very much.
Thank you, Dr. Mallika. Now I invite Dr. Sara Malik to present her experience on chronic tension type headache.
Screen visible?
Yes, Dr. Sara. You can.
Am I audible? Should I start?
You can enlarge the screen a bit.
Okay, ma'am.
A little more. Now it's better.
Okay.
Yes.
Okay. So good morning, everyone. I'm going to present a case series on the topic assessments of effects of individualized homeopathic medicines on quality of life of patients with chronic tension type headaches. Should I continue? Am I visible?
All is going well. Please continue, dear. Your time is going on.
Okay. Okay. So, to give a brief background first, headache is an extremely common symptom and it constitutes about 48.9% of prevalence in the general population. So, out of all the primary headaches, the three primary headaches, migraine, tension headache, and cluster headache, they constitute 98% of all headaches. Coming specifically to the chronic tension type headaches, these are basically very frequent episodes. They are typically bilateral. They have a band-like sensation or a pressing or tightening quality. They're usually mild to moderate and they're often triggered by stress. They're not life-threatening, but they significantly affect the quality of life of the sufferers. This case series is reflecting the impact of individualized homeopathic medicines, one in reducing the signs and symptoms of the chronic tension type headache patients, and also the potential these medicines have in enhancing the quality of life of the patients. So, coming to the methodology, this prospective observational study was carried out in the outpatient department of Dr. D.P. Rastogi Central Research Institute of Homeopathy, Noida, Uttar Pradesh. Uh, I took 5 cases of ages between 20 to 60 years of both sexes, and they were diagnosed with chronic tension type headache as per the International Classification of Headache Disorders, third. And after that, these cases were enrolled. These patients were prescribed individualized homeopathic medicines, and then I followed them on the monthly basis for 6 months. The analysis was done using two scales. One was Headache Disability Index, and the second was WHO Quality of Life Scale. This was done 3 times, one at the baseline, that is the first follow up, secondly at the third month, and lastly at the 6th month. Then the scores of both these scales were analyzed using one-way repeated measures ANOVA at baseline, third month, and then 6 months. Now, coming to the results, I have uh, accumulated the results in this particular table. So, as you can see, the 5 cases I've given the presenting complaints. Most of them have a duration of more than 2 years. Uh, Now coming to the headache disability index score, the in the first case it reduced from 94% to 40%. In the second case, it reduced from 95 to 30%. In the third case, it reduced from 90 to 46%. Fourth case, it reduced from 84 to 42%. And in the fifth case, it reduced from 48 to 28%. The scores of WHO quality of life also saw improvement in all the 4 domains, which are the psychological, the physical health, first domain, second is the psychological health, third is the personal relationships, and the fourth is the environmental health. So, all these 5 cases saw good improvement in all these 4 domains. The follow-up also saw a reduction in the number of headache episodes that were seen weekly, and later on, they reduced to 2 or 3 episodes each month. As you can see in the first case, the reduction is at 6 months is 3 episodes in the last month. Second case also there were just 2 episodes the last month. Um, Third case also 3 episodes. Fourth case 1 episode per week, that is 4 episodes in a month. And third and fifth case 3 episodes in the last month. Now coming to the medicines prescribed and the potency, Natramur was prescribed in 2 out of 5 cases. Other medicines that were prescribed are Calcarea Cap, Pulsatilla, and Causticum. So we saw a significant improvement in the scores at third and 6 months after the treatment with individualized homeopathic medicines on both these scales. And 4 out of 5 patients of this case series were females, which basically reiterates the fact that of the previous studies that have been done on tension type headache and chronic tension type headache, that most of the sufferers are females. Um, Now, concluding my case series, the homeopathic medicines do have potential to reduce the overall disability and improve the quality of life of chronic tension type headache. We need further studies with greater sample size and controlled populations. Thank you.
So, madam, can you tell what is the last message you are giving to the practitioners here? What you have statistically shown, or you have shown that there is improvement, but I am little bit skeptic in that how many people got total relief and not in this respect that really reduce like that. So these two questions will be answered. How many patients totally recovered, and how many patients were in the midst, and what was the message of totality building up to the patient, how they will prescribe in their practices?
Okay, sir. To answer your first question, we did a follow-up of 6 months. So total relief, I'll say I did not find, because that will again be a drawback of the study, because it was just followed up for 6 months for monthly basis. So there was still the patient still had few episodes, about 2 or 3 episodes that were there. But they definitely had tremendous relief, as we see from the baseline score. And coming to how I prescribed, I strictly followed the homeopathic basis of individualized homeopathic medicines. That is, I took a totality based on the mental generals, the physical generals, as well as the particulars. Because in this case series and in the study, I saw a lot of people with chronic tension type headache were also having a lot of comorbidities like anxiety, and obsessive compulsive disorder also was seen. So, like in case number 2, this she was a lady and she had obsessive compulsive disorder as well as anxiety episodes. I have mentioned briefly, and also in case number 1, like most, if you see the presenting complaints, most of them have anxiety as a comorbidity, which was also one of the findings of the study. So I definitely took the totality and then only prescribed the medicines. And if there was a need, like in first case number 1, there was a sudden increase in the headache, so I prescribed an acute medicine wherever it was needed. And
Okay.
otherwise, they were just the
Okay.
medicines and placebo.
Time is short. Okay, thank you. Okay, thank you. Pass on, please.
Dr. Wok.
Hi, just something to add. You said that you are using the one-way repeated measure ANOVA for the statistical analysis, but I do not see that results in your report. Do you have any results? I mean, from the statistical point of view?
I do have results, but I just have mentioned the scores in this particular table. I have not mentioned the cumulative results. I've only I did measure it for both the scales, and but I did not mention it. I just mentioned cumulatively that I saw improvement on all the 4 domains of WHO quality.
Yeah. You would, I mean, if you, it would be better if you mentioning that in the methodology, then we should mention about the results in the either the decision part or the result part. Otherwise, it would be quite suspicious, you know, especially for skeptics. So if you do not mention it in the methodology, then we know that it is not there in your protocol. But if you mention it in the methodology, that means this kind of tests are included in the protocol, then we have to report the results. Otherwise, people will suspect that maybe the result, it looks fine, but then when it puts into the statistic, actually it is not significant. So it should be included.
We'll keep that in mind.
You're welcome.
Thank you. Now I invite the next speaker, Dr. J.K. Solanki, to explain the utility of book headache in case of migraine.
Hello everyone. Am I audible?
Yes.
It's a great honor to present my thesis in here. So my topic is clinically validating utility of the book headache by genosequence in cases of migraine. Let's start with introduction. Migraine is the most common.
Can you increase your volume a little?
Yes, sir. Migraine is the third most common disorder globally. If we see in the less than 50s, in the global burden of disease study done on 2010. Many times patients come with headache as chief complaint or only perceptible trouble. So the ready work of the homeopathic materia medica on specially designed disease like this book can be handy in acute cases as well as in reference to the chronic ones. Why this book only? Because it was published in 1879, first edition. The second edition was published in 1890. If we look the technicality of timeline, Oric has published in 1900 and Dr. Kent has published in 1904. So we can see that this book is quite older in its time. So we must check its beauty in the recent age. Okay, the aim. To verify the utility of the book headache by genosequence in treating migraine headaches. If we want to use this book, it is usable in all kind of headaches. But I want to use it in a particular aspect of primary headache, and I thought that it is useful to select this migraine because it is more popular in the demography. Let's see methods. I have done this study in the Srimati S.I. Patel Homeopathic Hospital at Dr. V.H. Dave Homeopathic Medical College, Anand, Gujarat. And some cases are of my personal OPD from Rajkot. The study design is like analytical clinical trials because we are treating the patient in the clinical trials, one of the sub-classification of these analytical trials. Duration of study is of 9 months from August 2020 to April 2021. We have concluded all the cases from this timeline only. Sample size is 30 from simple randomization method. We have screened all the cases and then selected the 30 cases from the randomization method from the online randomized number table. The inclusion criteria. I have taken cases with age more than 10 years and less than 60 years because if we see the migraine cases, they decreases in frequency with the increasing of the age. So that's why I've selected this particular age. The other thing is pre-diagnosis cases of migraine or new cases of migraine fulfilling the ICHD-3 criteria of headaches. That is from International Classification of Headache Disorder 3. Which was published in 2018. The exclusion criteria are patients with migraine who were on the therapeutic measures of other disciplines. Because in India, people used to treat all kind of disorder with so many options like allopathy, Ayurveda, homeopathy, Siddha, Unani. So I have excluded other disciplinary methods and just treated who are with homeopathy. Then there is a secondary headache because I want to treat in a migraine headache. So I have to exclude all the secondary headache. If there is any systemic disorder, I cannot allow it in my study. And the third criteria is pregnancy. The reason is that in the pregnancy, lady sometimes it may happen that they abscond our study or she may have to go her maternal home. So that's why it is inconvenient for the further study. Statistical analysis. I have used MIDA score to evaluate the patient's condition before and after the homeopathic treatment. This MIDA score is a migraine disability assessment scoring test. It is used globally all over the world, and I have statistically analyzed the study with the paired t-test because I want to conduct this treatment with before and after test. So same patient has to give answer with MIDA score. And I will evaluate it with the paired t-test before and after. Okay, let's see the observations. If we see here, in the age group, I have classified the age group with the decades of life. If we see here, the second and third age group are the most number of cases. And in the review, it is mentioned that migraine peaks during second and third decade of life, and it decreases with increasing of age. So we can see that in the 31 to 40 years of age, it is 17%, and with 41 to 50%, it is only 13%. And the more than 51 years of age, it is only 10%. If we see for the diagnosis, I have made diagnosis from the ICSD criteria, and the migraine is further classified with its sub-classification. I have seen that migraine without aura is more seen, like 37%, and probable migraine without aura is 27%. So in addition, if we see the migraine without aura as a whole, it will conclude 64%. And I have read in review that almost 80% of migraine cases are of without aura. So it is quite suggestive. And the other diagnoses are chronic migraine, which is 20%, abdominal migraine, benign paroxysmal torticollis, benign paroxysmal vertigo, cyclical vomiting syndrome, and migraine with atypical aura. They are of one cases each, like 3%. And these abdominal migraine to cyclical vomiting syndrome are of episodic subclassification. Remedies. I have used total 22 numbers of remedies. The most frequent remedy was phosphorus. I have used in 3 cases in this study. And subsequent to that, belladonna, chalcemium, clonine, lacasis, muriaticum, sulfur, they are used in 2 cases with each remedy. Then there are so on many polyclast remedies. The reason behind that I have used many polyclast remedies is that in this book, Genosee King, he has mentioned 169 remedies, and most of them are polyclast. So it is happened that only this kind of remedies will come in my study. Now we see the assessment of cases with the response they give in the patient. I have seen 87% in a moderate improvement and only 3% in the cure ratio. The reason is that if we see in the response case, cure is mentioned where the patient has a complete sense of well-being and there is no relapse for not a single episode in the case. So I have one case where MEDA score was 74 before, and after that it becomes 0 in the next scoring system. So that's why I have 3% case where is cured. And for the moderate improvement, there is a criteria like there is a improvement in the patient's condition as well as decrease in the MEDA score. If we see in the mild improvement, there is improvement in the patient's condition if intensity and duration may decrease, but the MEDA score is as it is. So it is seen in 2 cases. So it is seen in 7% of my study. And status quo. There is one patient who didn't get any relief or any kind of we can say change with the treatment. So 3% are in the status quo. If you see the statistical analysis, I use PET-T test, and before and after a scoring system was done. The mean of before MEDA scores was 44.59, and after was 16.35. The variance is mentioned like 502 before and 56.5 after. 30 observations were taken. Degrees of freedom is 29 as per the statistics. If we calculate the statistic value, it is 6.9, around 7, and tabulated value, critical value, is 2.04. So here, statistic value is much higher than the tabulated value. So we can justify that our null hypothesis is rejected, and this study shows higher accuracy in analysis. I have verified total 161 symptoms with this study from the book Headache by Genosee King. I want to mention this p-value because it is not mentioned here in this slide for the poster. My p-value was 1.0727, where e is to 0.07. So that means my value becomes 0.00000127. So that shows higher, much lower p-value, around to almost near to 0. So that's why we can conclude that this statistical analysis is good enough. and I have used Microsoft Excel for this statistical analysis. Okay, thank you, sir.
Request the chair to give the comments fast.
So, how you, I have not seen that book, Hedak, but what I find, perhaps it is on the basis of common and uncommon symptoms at the particular level. Is it so?
No, sir. This book is prepared in a way that only headache symptoms are mentioned on a single paper, we can say. It is mentioned.
Not other physical journal, mental journals are not included therein.
No, sir. It's not like that. I am telling you that the
means
book.
Your prescription was totally on the basis of sector totality. Is it?
No, sir. I am justifying that. The book has mentioned the headache with the headings like note, then location, characteristic, and sensation, then modalities, then concomitants. So in the concomitant, author has mentioned the striking features of the drugs.
Then it is a particular symptom only. Only
no,
particular symptoms are mentioned in that book.
On the
no generals.
it is yes.
No generals.
On the major generals are taken. Thirsty or thirstless, or any thermal relation, or any mental features. So that's how it is taken.
So taken into account.
Yes, sir. I have taken into account.
Then how can you say that these symptoms, after relieving the symptoms of those, you claim that I verified the symptoms to be correct one? Is it?
Yes, sir. I have done repertorization to the cases in a holistic manner, and the remedy was selected on the basis of the book. The data this book is mentioned, I have collected that and I have reviewed that, and then after confirmation, I have prescribed my remedies. So that's
how many samples you took?
30 cases.
How?
30
cases. Then I think Madam will comment on that. Okay, pass on.
Thank you, sir.
Pass on.
Is that my turn?
Your time.
Sorry. All right. Yeah, I agree that because there is not much description of the book or the method that is being used. So from an audience point of view, I really cannot do much comment, because if your aim is to verify the utility of the book, then I suspect I think there should be more description on what is the book about. So do you mean that you are taking the case and then prescribe according to some kind of protocol in the book?
Sorry, ma'am, there is no like protocol. It's like ordinary materia medica, but more like regional one. If we see Bell's diarrhea, Minton's uterus, that kind of thing. So this book is only focusing on headache part. So I am just treating a case with the data given in this book. For example, if I say that in belladonna, it is mentioned that there is aggravation 3 p.m. So I have studied that in which repertoire, which book it is mentioned. So if we see in the synthesis repertoire, there are lots of drugs. And if we see in the belladonna, only cancer has given this 3 p.m. aggravation. So this book is also mentioned in the 3 p.m. aggravation. And if you see in the timeline, it was published way before the Kent ones. So that's how I came to the conclusion that this book should be studied or should be tested clinically.
Yeah, I think the aim maybe we keep it like whether prescription of homeopathy can help in this kind of cases of migraine would be a better aim rather than to verify the utility of the book. Just a little comment personally. But more important is if you are using a pair t-test to compare the pre-treatment score and the post-treatment score, I would expect you should also mention about the p-value. Not only the T statistics, because what I mean in the international publications, p-value is more important.
Yes, ma'am. If you can see that this is my total table, I have just emphasized the specific part in the poster. So this is the exact p value.
All right. Yeah. Yeah. So you instead of all those variants or so, it would be best and more representative. People can understand it just straight away that you report the two-tail p-value as maybe less than 0.001. Then it would be much more understandable and easily appreciated.
Yes, ma'am. Yes, ma'am. I will consider it in the future presentations.
Yeah.
Thank you. Now I would request Dr. Ria to present a case report on the usefulness of flushing method in acute diseases.
I shall share the screen now.
Sure.
Thank you. First of all, I would like to thank you, the LMHI, for giving me this such a wonderful opportunity to represent this small experiment. Now, I would like to represent the usefulness of flushing method in acute diseases. So, as we all know that rather than the uses of other method of administration rather than dry doses is very vague, and many lay persons have this many lay persons have these experiments done, and so I have just gone through one book of Prima Handley, the later Search of Hahnemann, and in which she give the Hahnemann's Paris practices all casework. And from that, I have come to know that he has also experimented this all methods, from which he used flushing method before coming on the LM scale. So I just thought to give it a small trial. So I use this. I have done this experiment, and I have done this experiment by the guidelines given by Dr. Luc de Seffer in his book Achieving and Maintaining the Simillimum. He gives certain guidelines to how to prescribe in flushing method. So the objective of my study was to prove the usefulness of administration of flushing method as per the guidelines given by Dr. Luc de Seffer in acute disease. The total sample of this study was 30 cases, which were collected from Srimati S.I. Patel Homeopathic Medical College, Anand, and some cases were from my personal OPD, Kosamba, and they were evaluated on the basis of inclusion and exclusion criteria, and with the help of the simple randomization. The study duration was 9 months, since August 2020 to April 2021. The inclusion criteria were the cases which were pure acute in the nature and the cases which were acute exacerbation of chronic diseases. And the pure chronic cases in nature were excluded from this study. Then the remedies, they are administered to the patient in flushing method, as Dr. Luc de Seffer have given the guidelines in his book, that to take 1 or 2 globules from the selected potency and then dissolve it in 16 tablespoonful water and prepare the remedy stock bottle, and then take 1 or 2 teaspoonful from that and add it into the cup and small cup with half that amount of water in that cup, and stirring it and then applying it to the patient. And for the second the second prescription of dose, we should take 1 or 2 tablespoons from the first cup and and add it to the second cup with the half cup of water and stir it. And as from that, we can prepare the more dosages as per the requirement. Then data analysis. So it was done per two criteria. First, the cured one, the disappearance of presenting complaints with the sense of well-being in 15 to 20 days in pure acute pictures were concluded as cured cases, and improved cases, general sense of well-being with reduction in intensity and frequency of complaints for which patient has approached were concluded as improved patients. Then statistical analysis. So for statistical analysis, MIMOC score was used for first pre-treatment and post-treatment evaluation of the patient, and then it was statistically analyzed by PAT-T test as per the mean value of MIMOC pre-treatment score and MIMOC post-treatment score. Then these were my observations. Total 30 from total 30 cases, there were 63% were female and 37% were male. And I have not excluded any age group. I have concluded all age groups for this because it was just my experiment. That's why. So total 60 to 40 years of age group was more in my study, that 44%, and others are downward. Then the phase of the disease or as it is acute or acute exacerbation of chronic diseases. So there were 73.33% cases were pure acute in nature, and 26.67% were acute exacerbation of the chronic disease. And these were the total number of remedies. In my 30 cases, there were total 15 remedies which were used, and the more number was Bryannia alba, Nux vomica, belladonna, pulsatilla, arsenic, as they were repeating more in these 30 cases. And as we can see the results, so there were 53% cases which were cured, and 47% cases were in improved criteria. But in these 47% of cases, the 26% of cases were from acute exacerbation of chronic disease, which I have put in the improved cases because they were more nature was chronic.
Please conclude fast, please.
Okay, sir. This is my result of the PAT-T test. As we can see, the mean before treatment and after treatment is 4.54 and 0.15. This is the variance 0.83 or 0.075, and the statistical value was 27.38, and the critical two-tail value was 2.04, and the power value of two critical detail was 2.83:22. So as we can see in this result, that T calculated is more much more than T tabulated. So this we can conclude this as a significant result. At last, I would like to thank LMHI and my colleagues. Thank you so much.
There's a request that all the speakers please see that you finish your complete presentation in 7 minutes, because a lot of speakers have to speak and we don't have time. And also I request the chair also to limit the comments to 3 minutes so that the entire presentation finishes by 10 minutes.
Okay.
Chair for comments.
Madam,
yes,
do you know that the definition of acute disease comes suddenly, have a rapid course, finish the course quickly, and type taking is very short. So there are some
Yes.
self-limiting diseases. Acute
Yes,
disease is a number of diseases. How you define them?
Sir, actually, I have one limitation of this my study. I have forgot to mention the time period of of my result, matlab follow-up. I have seen the improvement in 1 or 2 days. So that's why I concluded that.
It is variable for disease-wise also.
Yes, sir. And I accept that
So
I
now you
forgot that.
understand. Okay, thanks. Pass on to madam.
Okay.
Because of the time limitation, perhaps we just keep one chair comment for each presenter. Would that be better, coordinator?
Yeah, or you can do alternate presentations.
That would be better. Yeah,
Oh.
I know the time is running short. Yeah, next. Thank you for your presentation, and let's have the next presentation. Thank you.
Okay.
Thank you.
So I invite Dr. Rajat Kumar Pal to present his case report on myelomeningocele.
Yes.
It has started. Yes.
You can zoom it a little.
Is this better now, sir?
No, now it's gone.
Okay. Is this fine?
We are getting.
Yes, you will.
Yeah.
Okay. So a very warm good morning to everyone. And it's my pleasure to present this case in front of you all today. The title of my presentation is that chronic hip pain and abnormal blood values managed in a patient of polycythemia vera with individualized homeopathic medicine. Now, this is a case of a 58-year-old male, an ex-army personnel who was a known case of polycythemia vera since 2018. The patient came to our OPD on 18th of August 2021 with the main complaint of chronic bilateral hip pain, which was worse on the right side. The patient described his pain as very deep-seated and it was a locked-up feeling. And he described a pain intensity of 9 as per the NRS pain scale. The severe pain restricted his ability to do his daily course and it was greatly deteriorating his life quality. The modalities of the pain were that it was worse on the right side, it was worse in cold weather, and in evening around 5 to 6 p.m. The patient depended heavily on painkillers to get some relief from the pain during these episodes. And there was no other major complaint or other constitutional symptoms related to his diagnosis of polycythemia vera, except for occasional heaviness in the head. Now, the history of presenting complaints was that the patient started experiencing these severe episodic hip pains in 2015 after his retirement from the army. While the patient was undergoing routine investigations for the hip pain, in 2018, his blood work showed abnormally high values of hemoglobin. Subsequently, the hematocrit was high and the white blood cell count was also high. As you can see in this report, in 2018, in the month of May, when he got a blood investigation done, his hemoglobin was 20.2 gram per deciliter. And the hematocrit was 63.1%. His white blood cell count was also high. There were several other blood reports. Because of the space constraint, I couldn't share all the reports. And in all those investigations, his hemoglobin levels varied between 18 to 20 gram per deciliter, while the normal upper limit for males is 17.5 gram per deciliter. The hematocrit was also between 58 to 62%, while the normal range is 41 to 50% for men. Because of these abnormally high blood values, further investigations were done, and in that JAK2 gene mutation was detected, and bone marrow biopsy showed pan-myelosis, and hence the diagnosis of primary polycythemia vera was confirmed. Now, in the past history, there was no significant past history, no predominant comorbidities were present. There was no significant family history. In social history, the patient had a history of smoking, but was reformed since last 8 years, and he was an occasional intake of alcohol was there. In investigations, besides this genetic testing and the bone marrow biopsy, other blood markers were tested like CRP, ANA, HLA-B27, but they were all found to be negative. In 2017, the X-ray of the right hip joint showed marginal osteophytes, but the MRI pelvis was within normal limits. So no direct cause was found for this severe episodic hip pains. The treatment that the patient took before starting homeopathic treatment was, he was advised to undergo phlebotomy as and when needed to ease the congestive symptoms like headache. Besides that, he was just advised to take painkillers for this hip pain. And as he did not have any other major symptoms for polycythemia vera, he was not undergoing any major treatment. He was just advised to keep a regular check on his blood count and undergo a phlebotomy as and when required. The patient took treatment from different doctors and physiotherapists, but he did not find any relief in the hip pain. Now, when the homeopathic treatment was started in August, the detailed case taking showed that the following general symptoms were marked in this patient. The pain was worse on right side. The patient had desire for excessively hot tea. And at the level of mental generals, the patient was found to be very submissive and quite, he was folding hands. And during the consultation also, he was found to be very inferior related to authority figures and was quite dominant on his family members, especially his children. So on the basis of these general symptoms, I prescribed Lycopodium clavatum to the patient. LM potency was chosen for a need of more frequent repetition to ease the pain and to avoid risk of any homeopathic aggravation. So on 18th August, Lycopodium 0/1 was started, BD, for 15 days. First follow-up was taken after 12 days on 31st of August, when the patient reported a significant relief in his pain, and patient was feeling generally much better. And on that day, Lycopodium 0/3, I continued for the next 15 days. Same dosage was repeated, BD. The second follow-up was on 21st of September, after 21 days, when the patient described that he had no significant pain in his hips during that period, but he had little stiffness in his knees. So I continued with the same dosage BD, but higher potency was given, Lyco 0/5, for the next 15 days. The third and the last follow-up that I had was on 30th of October, and the patient reported a negligible pain, and he reported on the NRS pain scale as a low intensity of 1. When the patient came for the last follow-up, the patient got a blood report done of his own accord on 27th of October, which I've shared here in comparison. And in that, we can see that his hemoglobin and HCT values are within normal range. Now, I did not advise any blood test in the beginning of the treatment because patient had undergone several investigations before. And my main focus of treatment was to give him relief in the hip pain. So the patient is still under follow-up, and till now, he has not reported any kind of a relapse of the pain. So I conclude that the patient had significant relief in this chronic hip pain with the homeopathic treatment. And also the latest blood report showed normal values. So as chronic pains can make a patient life miserable, and homeopathy can prove to be a great, gentle and safe approach in such cases. So more research can be done in this direction. Also, role of homeopathy in palliative management of such cases like polycythemia vera can be undertaken in the future. Thank you very much.
Thank you. Can you scroll down the poster? Did you mention about what remedy have you given and how did you give it in the poster?
Yes, ma'am. Yes, ma'am. I've shown it. I'm not able to scroll it down. And you can see in the lower part where I've written on the basis of these, Lycopodium clavatum was given. And then I've written that Lyco 0/1 BD was started and subsequently potency was increased with the same dosage.
Very good. Yeah, it should be mentioned. Yeah, I didn't hear it.
Okay,
but
okay.
and then second thing is I've forgotten what I what I wanted to say. But one is just follow-up you have mentioned about, and then the diagnosis you have mentioned about, and then comparison. All right. So nice presentation, and I think it would be better if you can mention also at the results of the part, if you can also mention about the general symptoms like the emotional status or general status of the patient, to complete a more comprehensive report of the general status of the patient instead of just like the single item. Yeah, it would
Ma'am,
be
actually,
much
because
better
of
for.
I understand your point, ma'am. Because of the space constraint in this poster, I just mentioned the prescribing symptoms, the symptoms that I based my prescription on in the method part. So there I've mentioned, but I did not mention the past history and other investigations which were not significant because of the space constraint. But I do have all
Okay.
the reports.
All right.
Thank you
Thank
so
you.
much, ma'am. Thank you.
Okay, there is no question.
I call upon
I've
Dr.
understood. I've understood now.
Okay, sir. Thank you.
Pass on to next.
Thank you. I'd like to invite Dr. Rajat Kumar Pal to present his case report on myelomeningocele. No, you're not audible.
Am I audible?
Yes.
My screen shared?
Yes.
Okay.
No, you're not audible.
Am I audible?
Yes.
Homeopathic treatment of myelomeningocele, a case report.
Yes.
Myself, Dr. Rajat Kumar Pal, Professor and Head of the Department
No,
Repertory.
you're not audible.
Am I audible?
Yes. Dr. Rajat, I think you have the same technical issue going on. So
A case report.
yes.
Myself, Dr. Rajat Kumar Pal, Professor and Head of the Department
No,
Repertory.
you're not audible.
Am I audible?
Dr. Rajat, you may please log out. I'll give you a chance at the last. Dr. Rajat, I think you have the same technical issue going on.
A case report.
Yes.
Myself, Dr. Rajat Kumar Pal.
Hello, I'm just working with the IT team, so ma'am, kindly wait for 2-3 minutes.
Okay. Good morning, everybody. It is a great honor to me to participate here to present my case, and I must congratulate every active members of LMHI 2021 Global Curriculum. This is the case of homeopathic treatment of myelomeningocele, a case report. Myself, Professor and Head of the Department of Repertory, DN Homeopathic Medical College and Hospital, Government of West Bengal. The case abstract is myelomeningocele is one of the common neural tube defects affecting the newborn, mostly due to the folate deficiency during pregnancy. Though it is a surgical case, homeopathy provides a better response in such conditions. One such case report is presented below. Patient attended our OPD when I was in my previous college, that is a Calcutta Homeopathic Medical College and Hospital, chiefly for complaints of swelling and ulceration at the lumbosacral region with mild venous discharge since birth. Due to lack of financial support and got very less assurance from Department of Pediatric Surgery, patient turned to homeopathic treatment. Within few days of homeopathic treatment, the patient started improving and continuing homeopathic treatment from CHMCH OPD and also attending our OPD now and showing marked gradual improvement like significant decrease of size of the head with neck stability and significant reduction of the size of the swelling in the low back region due to the myelomeningocele with a stoppage of venous secretion and showing the significant change in the developmental milestone. In the right side of the image, in the next image, it is near about 10 months. After the 10 months of treatment, I'm showing later on. There's the introduction is regarding the entities, better the few clinical presentation pictures that's present with in our day-to-day OPD. There's a hydrocephalus cystic swelling, low back region, and leg weakness and paralysis, poor ability to walk, problems with bladder and bowel control, including the incontinence of urine, urinary tract infections, poor kidney functions, and difficulty in executive and academic skills. Orthopedic abnormalities are there. And among the investigation, blood for CBC, X-ray, MRI of LS spine, CSF exam would be done. And we did it from the other modern medicine hospital. And that was the case resembled like this when patient came, is a very 1-year child, 8 months child, and had this type of swelling. With from there, the CSF, that is a senous discharge, was there. So case I'm entering in my case report because of the lack of time. Case, a 8-month-old male patient attended our OPD of the Calcutta Homeopathic Medical College in January 2017 with the following complaint: swelling and ulceration at the low back region with mild senous discharge since birth, frequent fainting spells, and enlargement of the head because there is a huge enlargement, and occasionally mild feverish condition. And present HPC, there is a history of present complaint. That is a very, very important in homeopathic treatment. The patient was taken at first the Bangalore Institute of Neuroscience, Kolkata, in year 2016. And it was seen that the increasing head size and occasional vomiting since birth, and was attack seizure one time, history of recurrent respiratory tract infection, and delayed cry at birth followed by NICU care. On examination, when patient came to us also, there is a very, very poor neck stability, poor neck control, diminished spontaneous movement of the lower limbs, fontanelis bulge but not tense, soft tissue swelling at lower back with a senous discharge. Since birth were seen, and they advised incessity of the head and plain MRI of the lumbosacral spine, and diagnosed as obstructed hydrocephalus due to aqueductal stenosis and lumbar myelomeningocele, respectively. That is a very tough case to handle. And asked the patient party for the surgical intervention of the patient, but they denied. They came to us due to the problem I have said earlier. And family history, nothing significant. And obstetrical history is very, very important. That is the main issue. Mother was not taken IFA, iron folic acid, during pregnancy. And birth weight was 3.5 kg, and baby was born after EDD. And also delayed cry at the birth followed by the NIC care. Generalities, that is very important. Appetite was good. When I see the patient, appetite is very good. His tongue is moist, salivated profusely, thirst is moderate. Desire for non-veg product, that is the key of my case, especially meat, chicken, and eggs, almost required every day during meal, should have to take, otherwise the patient did not take any food. And the bowel regular, passes stool 1 or 2 times, soft inconsistency, offensive, blood, urine was also offensive, and the perspiration also moderate and offensive, sleep, nothing abnormality detected, and thermal reaction was a hot patient. A local examination, 2 centimeter by 2 centimeter, sacral region was a soft swelling tissue, soft cystic appearance, and mild senous discharge from there. Systemic examinations of poor neck control, difficulty in holding the neck, reduced limb movement, and all sensory were normal. Respiratory system, cardiovascular was normal. Analysis of the case, that is the main issues. After the analyzing the symptoms of the case, the physical characteristic symptoms and the particular symptoms are considered, because for a child, the mental symptoms I could not take properly. And I better to say it was not prominent to me. And tongue is moist and salivated profusely. Desire for meat, eggs, as stool was offensive, perspiration was offensive, thermal reaction, hot patient. These only general and the particular symptoms I've taken into consideration in my case. And swelling and ulceration at the sacral region with a mild senous discharge since birth. Miasmatic evaluation for the presenting symptoms was done and showed the predominance of the both SORA and syphilis, because there is a dominating desire for the meat, chicken, and against of the syphilitic symptoms. Considering the above-mentioned symptomatology, Dr. Kent repertory were preferred to me, and ultimately repetition is done through the complete repertory by using the authentic HomePath software, as I believe the complete repertory, one of the most augmented version of the Kent repertory, and we can support it. And now repertory for my prescription, I consulted Genti's repertory, Boger's characteristic repertory, and now repertory from my software. And considering the repatriation, predominant miasm, and consulting with the authentic Materia Medica, the medicine was given Calcarea Force 0/2. I can explain why. Now, better to see, if I go to my slide, this is the date, visit date. It is a 15/9/2017, just significantly reduced, and 27/10/2017, further reduced. And this is my repetition sheet. In repetition, is it visible or not? I don't know, but I'm try to further just to see that complete genital heat, warm, hot becoming, child is cold taking, become easily, thirst is steam, food and drinks, mid desire, salivation night, offensive, and spina bifida. If I take into consideration the calcarea, phosphorus, tuberculum, mercury are very close running, and nitric acid also there. But I continued the calcarea phos. And after calcarea phos, I started with the 0/2, then 0/4, 0/6, and ultimately I went to 0/12.
Please conclude fast.
Okay. Just 0/12. That is the 15/9/2017. And just 27/10/2017, I changed to the Marxwell 0/2 because the predominating symptoms from soda to most syphilitic. And all these symptoms favor for prescribing the Marxwell 0/2. And still, till date, he is on the Marxwell. And significantly, his further improvement was there. But just you see, 21/12/2018, after the near about the 9 months, he came. Her parents bring to me. And within that time, what happened? They discontinued. And this is the picture. This is the 20th September 2019. They again the ulceration developed, and there's a pressure so developed. But after Marxwell continued, again 13th January 2020 is totally healed up. Now this is the date, March 2020. Now patient can see properly without any support. It's a very good neck control. And if you see here is a mother lab. Visit date is the 28th 2018. Also the neck stability was there. And the case is improving. And I'm going to the straight away my conclusion. As myelomeningocele is one of the common and severe form of neural defects affecting the newborn, mostly due to the folate deficiency during pregnancy. It is advisable to start recommended dose of folic acid as soon as possible who is planning for pregnancy or who is already conceived, because no child should born with this defect, though homeopathy have effective role to treat this type of surgical disorder. And acknowledgement, parents or patient for giving us consent to treat at OPD, CHMCH, Gain the Homeopathy Medical College and Hospital. Thank you and again, I should convey my congratulations to LMHI group.
Request the chair.
Dr. Mahati, you have not yet unmuted yourself.
Dr. Pal?
Yes.
What was the age of that child when he reported to you?
Sir, 10 months to 11 months.
At that time, you collected that he was desiring for meat, chicken and egg.
Yes, sir, because that patient from the Muslim family, that is I am giving this trace. Patient of the Muslim family. Yes.
No teeth, total eruption, how he was taking.
Yes, sir. That is why they told me, that is I am giving this trace over here for prescribing. Point is that though calcarea and the phosphorus. And if you open our gentry repertory, only the calcarea phos in the spina bifida. And I could not prescribe the calcarea, though it came at first. But calcarea was a very chilly patient and excessive perspiration. And here the patient was a hot, and the phosphorus I could not prescribe. Because on the basis of that, due to the abnormal craving for in that age group, I had to prescribe calcarea phos, and gentry repertory guide me to prescribe that.
I have no doubt regarding your improvement. That's what you have shown. So thank you very much. Thank you.
Okay.
I pass on to the next.
Oh, acha. Good evening, everyone. Today I am sharing my study, the efficacy of individualized homeopathic treatment in seronegative spondyloarthropathy, which is an open label observational study. So seronegative spondyloarthropathy is basically a heterogeneous group of inflammatory non-synovial musculoskeletal disease, which shows their clinical and these has basically with the connection with positive HLA-B27 gene and high ESR rate and high CRP values also. And also, as these are the seronegative spondyloarthropathy, so there is absence of RA factor, serum RA factor. So basic characteristics of this disease are long-term low back pain with stiffness, basically aggravates during night, late night and early morning, which is radiates through the buttock or hip and generally ameliorates with gentle massage or exercise. And basically this spondyloarthropathy has distinctive two categories. One is axial and one is peripheral. So axial category generally involves the axial skeleton, basically the sacroiliac joint, and peripheral one is involving the all peripheral small joints of fingers and toes, and they are two distinguished diagnostic characters for them. So for sacroiliac involvement, there is positive sacroiliitis imaging, and with any positive feature of spondyloarthropathy is diagnostic for axial one. And peripheral one, there is asymmetrical oligoarthritis or monoarthritis with presence of enthesitis and presence of any other two of them. Spondyloarthropathy is positive diagnostic for peripheral one. Now coming to the aim and objective, we are here, it is to evaluate the efficacy of individualized homeopathic treatment with individualized homeopathic treatment by the help of DAS28 score and VAS score. And patients who are included in this study were assessed with the help of this at the baseline of the treatment, then at the 3rd month of the study or the mid study, and then the 6th month of the study. And then these changes are compared with the baseline. And second aim was to ascertain all the appropriate homeopathic remedies in these cases. Then materials and methods where this study was an prospective single arm and clinical study, an observational study. The case was studied in the Calcutta Homeopathic Medical College and Hospital, OPD, for 1 year. And each of every patient was followed up for 6 months with an interval of 1 month or less as per requirement. All the laboratory investigations and DAS28 score and VAS score, these are all done at the baseline of the study, then 3rd month of the study, and then end of the study or the 6th month of the study. Now, at first, after the preliminary screening, at first 76 patients were screened out. Then, according to inclusion and exclusion criteria, only 42 patients were included, as they were willing to give informed consent and capable for participating, and their age group fallen between 18 to 70 years, and they have positive spondyloarthropathic features, so they are included, and rest of them were excluded due to various reasons, like they are not capable for participating or not willing to give informed consent, or having long-term other systemic diseases, or lactating or pregnant mother, or self-reported immune compromised state. So that's why they are excluded from the study. Now, these 42 patients were followed up for a period of 1 year, and on them, in-depth case taking was done, evaluation of symptom, repertorial analysis, and miasmatic analysis, all are done, and individualized homeopathic treatment was given on them. And during this study period, another 12 patients were excluded due to other various reasons. So finally, we got 30 patients, 30 cases of spondyloarthropathy, and we found the results. Here is the result. You can see. So we can see in the first prescription, sulfur, Rastox, Caustica medurinum, these are the mostly used medicine which are used in first prescription. And when we see the second prescription, Rastox, Pulsatilla, Causticum, these are Calibicrom, these are the mostly used patient from the which is found in the second prescription. And also salicylic acid, this is mostly used during the acute exacerbation to combat the acute exacerbation of the disease mainly. Now I am coming to the result of the study, that is according to DASH 28 scoring, we can categorize the result into three, that is improved, not improved, and moderately improved. So we can see that 27% patients were, out of 30 cases, were not improved, 40% cases were improved moderately, and 33% cases were improved. And another one is we can find that disease activity, that is categorized into four, that is remission, low disease activity, moderate disease activity, and high disease activity. We can see in this disease remission of disease is 13%, low disease activity was 16%, high disease activity was 17%, and moderate disease activity was 43%. And at last, at the statistical analysis, the ANOVA, one-way ANOVA was done, as these 30 cases were normally distributed and independently drawn. So one-way ANOVA is done. So here, the to get the efficacy of homeopathic treatment, the means of the baseline DAS and VAS score is compared with the means of the third month or mid-study DAS and VAS score, and 6th month, means of the 6th month DAS and VAS score. So comparing them, we find the F value that was very different from the table F value or F grid value. So it is, we can see that there is huge difference from the table F value to our final result F value. So we can conclude that homeopathy treatment is the promising treatment system. It may help the patient to combat the acute exacerbation as well as chronic exacerbation of seronegative spondyloarthropathy. Thank you.
Yes, madam. What was the robust parameter to assess the rheumatoid arthritis? Hello.
So, rheumatoid arthritis is generally positive RA factor is there. In this study,
case, there was no RA positive because it was a seronegative, you told.
Yes, yes.
So what
in
should
this
have been
case,
other test? What should have been other test to be done to ascertain that it is a case of rheumatoid arthritis?
Sir, this is not rheumatoid arthritis.
No, it is. Did you conduct anticyclic saturated polypeptide antibody test?
No, in this study, I didn't conduct it. I generally patient came with MRI positive sacroiliitis or having HLA-B27 positive. So that's why I did not conclude ANA.
Because that is the robust parameter to assess the rheumatoid arthritis. If it is seronegative,
yes, yes.
So you have not done that. Okay, okay.
No, I have not
so
done
I pass on to Madam Chairperson.
Yes.
No, I have nothing to add. Yeah, we need to go. We need to go to the next one, please.
So thank you. I would like to invite the next participant, Mr. Lee, to present his case report on infant eczema.
Okay, hi. Can I share the screen?
You may.
Do you see my poster?
Yes.
Okay. Okay, hi everyone. I'm Seamus from Hong Kong Association of Homeopathy. It's my pleasure to be here to present the case report, Homeopathy treating serious eczema of a newborn baby. So this is the patient. She was a 3-month-old baby girl who got eczema all over her face and the torso. And since her first month of life, and she was brought to us by her mother. And before coming to us, topical steroid had been used, and the patient was under the withdrawal of steroid because the steroid therapy didn't give satisfying results. So the patient was not suitable for verbal consultation. For newborn baby, it's learned from our experience that there could be a huge myosomatic connection, the influence from parents. So the patient's parents were first consulted for a deeper understanding of their constitution, and the repertorization were done using the synthesis repertory. This is the repertorization for the patient's mother. She got the theme of fear and fright and delusion of animal. These are my rubrics, like elements from fear, delusion, frightful animals. And we found that the plant kingdom, Solanaceae family, the family of belladonna, matched the theme, fright and fear. And the mother was of strong psychotic type, so I gave her the remedy, Fabiana imbricate. And this is the repertorization for the patient's father. He had a theme of being abused, dominated, sexuality, and compass. So these are the rubrics, something like delusion, being trapped, elements from domination, and also some of his physical symptoms. And I gave him the remedy, nausea, a snake remedy. And both remedy works very well for the parents. So it's time to determine the dominating constitution of the baby patient. So we need to compare very carefully the most strange, rare, peculiar SRP symptoms of the patient to her parents. So I first found two very special points. First, the patient will easily get frightened and cry without any reason, especially after midnight. And also by talking to the patient, even though she could not speak yet, not only ameliorates her fear, her emotion, but also ameliorates her itchiness of the asthma. So we found that the patient was very similar to her mother's. So I decided to give her the remedy in Fabiana imbricate 30C with 12 cups dilution, 1 sip each time. And the West dosage was used to reduce the intensity of possible homeopathic aggravation. So this is the patient after using the first remedy, and she sleep better with less fear, and you can see that the skin looks better with less swelling, less scale-like skin. And every dosage could last for 1 or 2 days and could calm down her emotion and the itchiness. And when the symptoms come back, we will repeat the remedy. And then we gradually, when repeating the remedy do not give ameliorating effect, we gradually change the dosage from 12 cups 1 sip to 5 cups 1 sip. And over the process, there's no adverse events. And however, the progression becomes stagnant after 5 months of using the first remedy. So this is a time to determine the dominating constitution again. So we find that after 5 months of using the Fabiana, the patient become much different from her mother now. She will get angry and irritable easily, and she will especially act very violently when others get into her territory, like touching her belongings, her bowl, her tableware. So the patient is now like a little animal, like her father's. So I decided to give her the remedy of her father, nausea, 30C, 8 cups, 1 sip. And I repeat the remedy like before with the same manner. So this is the patient after using the second remedy. You can see from this photograph record that the main complaints, the asthma, have greatly improved. Also, we found that the overall being, like the emotion, the fear, and also her bowel movement also improved. And we can see the healing direction from a deeper aspect to a more superficial aspect, like from the mental part, the sleep, the fear, the emotion improve first, along with a temporary aggravation of skin discharge. This is the homeopathic aggravation. Then the skin improve from the head to the torso, to the arms, and to the legs. This is the direction from top downward. So these are some of the indications showing that homeopathy treatment are very likely contributing to the improvement. And these are some of the criteria in this Monner criteria. I used the Monner criteria and it gives 11 out of 13 points. So it gives a hint that the homeopathic treatment are highly contributing to the improvement. So what this case gives the lesson to us is that for a baby case or infant's case, since the patients are too young for verbal consultation, we could not ask him any question. So considering the parents' constitution could be very useful. And we often find that the baby will inherit the parents' constitution, either of the parents. So to determine the dominating constitution, we need to carefully observe for the baby's habits, character, emotion, fear, and behavior. So also in this case, this demonstrates that the dominating constitution could change during the whole process. And also in this case, wax dosage were used with a number of cups dilution. It is very useful for hypersensitive case like this, like asthma, and allergy, something like that, to smoothen the hyperactive symptoms. So that's the end of my presentation. Thank you.
Dr. Lee, did you resorted to any auxiliary treatment during this medication?
Sorry, can you say again?
Did you resort to any kind of auxiliary treatment application, external application or something like that to your patient during that treatment?
I didn't give any external application, but the patient before coming to us, she have used some steroid, topical steroid.
Okay, okay. Okay, understood.
Okay,
okay. Pass on.
Yes, please.
Ma'am, any comments?
Next patient. I mean next presenter, please.
Thank you.
Okay. So next, I would like to call upon Dr. Ashwini to present a case series on scabies.
So good morning. Thank you for giving me such a wonderful opportunity. I am Dr. Vaidyanik Gupta, Assistant Professor in Dr. RBC Gaya Homeopathic Medical College and Hospital, Bodh Gaya, Bihar. The topic of my poster is a study on efficacy of homeopathic medicines on acute tonsillitis, a case control study. It is a study that comprises acute tonsillitis and its homeopathic treatment, where randomly selected patients of particular age group of different sex, religion, and socioeconomic condition were taken. So these are the methods. It is an experimental, prospective, single-blind, placebo-controlled study, which is designed for the 35 individuals, in which 30 were experimental group, to whom constitutional medicine were given as per the totality of symptom after the departization, and 5 were placebo-controlled group, to whom only placebo was given. The aim of the study was to study the clinical presentation of the tonsillitis and to know the efficacy of homeopathic medicine on acute tonsillitis. So as we know, there are two hypotheses, the null hypothesis and the alternative hypothesis. So in which the null hypothesis is just a sampling variation, there is nothing else. While in the alternative hypothesis, it is the improvement in case of acute tonsillitis by homeopathic medicine on the basis of individualization over placebo is because of the effect of medicine, not just by the sampling variation or just by the chance. The inclusion criteria were age group between 10 to 25 years of age, patients of both sexes and all ethnic groups, clinically diagnosed cases of ICD J03, that is acute tonsillitis, and exclusion criteria was cases with any complications of tonsillitis and cases with tonsillitis associated with any other chronic and systemic disease on active treatment. As because some 5 patients were given placebo, so it's unethical to increase their suffering. So we just took the patients having slight symptoms like acute tonsillitis. So this was the age group in which it was divided into 4 parts as a class interval of 4 group, 4 years. That's 10 to 13, 14 to 17, 18 to 21, and 22 to 25. Just like that, the clinical outcome was in 5 group: cured, marked improvement, moderate improvement, no improvement, and dropouts. In experimental group, there were 2 dropouts, while in control group, there were no dropouts. This is the analysis of remedy in which the medicines were given, like belladonna and hypersulfur were given to 5 patients each in out of 30 cases, 3 to beta carb and Merxol, 2 each of aconite, laccan, and phosphorus, and 1 each to lachesis, phytolacca, arsenic album, bacteria, pustula, natrium, nitric acid, and phytolacca. Statistical analysis were done as there were 2 dropouts, so only 33 cases were taken. So this is by applying chi-square test, and degree of is 15.13. For the degree of freedom of 1, as a p-value, the probability value of 95% is 3.84, and the value I got is 15.13. So the calculated value was far greater than table value. So NS was rejected, and alternative hypothesis was accepted that homeopathic medicines, the improvement was because of individualization and by homeopathic medicine rather than just by the sampling variation or by chance. So I concluded that the constitutional treatment based on the totality of symptoms proved to be best for the treatment, and homeopathic remedies are effective over placebo, and the results are encouraging. Thank you.
Madam Gupta?
Yes, sir.
So what are the remedy came to prescription? For prescription, you have not delineated. Can you highlight that for practitioners are listening to you and many more?
So these are the remedies.
So it is belladonna and mercurius.
Belladonna, hypersulfur, beta carb, Merxol, aconite, laccan, phosphorus, lachesis, phytolacca, arsenic album, bacteria.
How you selected these remedies?
ना तू अपना ला
हॉटस्पॉट ला जल्दी से
जल्दी अपना फोन लेके आ फोन यहीं
अमृत मैम प्लीज म्यूट योरसेल्फ
What was the basis of your totality building for acute totality? Because it is acute disease you have told, because acute tonsillitis.
So it was complete case taking, like thorough case taking was done as per standard case taking performer that I got from my department in my college from where I did MD, and the proper analysis and evaluation of the case was done, and the DAR 10 was used for the fertilization. And as per the totality of symptoms, the selected remedy was further consulted to Materia Medica, and then the final remedy was selected.
That means for acute disease, you also took mental general, physical general.
Yes, sir.
But Hahnemann has told that most troublesome symptom, most prominent symptom, and
So, but general symptoms are important, so I took both symptoms.
must be taken. But you have gone for chronic miasm prescription also by pro. So how you claim that we have control acute? For acute also you require that?
Sir, I have taken all the symptoms because general we can't avoid the general symptoms. That's why I selected those.
Okay, madam, please.
Sorry, just one point, very important point to add. This study is not a case control design. Okay, a case control design is a retrospective design where we find a case and then we retrospectively go into the control. So the topic is not correct. You need to adjust it.
It's a placebo control trial.
Yeah, it is a placebo control trial. However, do you do randomization or not?
Sorry?
Do you do randomization or not?
Yeah, yes, I did.
So you do randomization, randomized trial. Okay, so in the research design, you have to make it clear. Otherwise, it is confused. The topic and the whole presentation is not coherent.
Okay, I got it. Okay. Thank you.
Shall I call upon the next speaker, Dr. Nazmul Hassan, to explain about chronic suppurative otitis media?
Can you hear me? Is
Yes.
there any Is there any background noises?
No.
Okay, thank you. I'll start my sharing. So this is my presentation, and it is titled as Chronic Suppurative Otitis Media caused the hearing.
Pardon, sir. There is some noise in your background.
Actually, Azan is going on, so if you please allow me 2 minutes, then it will be muted again.
So we are running short of time. You may
Okay.
continue You may continue. Okay.
Okay, thank you, thank you. So as I was telling that this is the my presentation, chronic suppurative otitis media, causing impaired hearing, resulting low quality of life, and we tried to find out the scope of homeopathy in this sort of patients. And this was my MPhil research presentation. This research was supervised by Dr. Anwarul Azim Akhund, Dr. Latiful Bari, and Dr. Nazmul Hassan from the Department of Genetic Engineering and Biotechnology, University of Dhaka. And Dr. Bari was the chief scientist at Center of Advanced Research in Science. However, as we know that the CSM is considered one of the major health issues among the school-going children in developing countries. It could be characterized by discharge and other things, including the perforated tympanic membrane. And antibiotics are usually used indiscriminately, but the results are not that satisfactory. And moreover, the tympanic membrane healing and the hearing impairment is not corrected by the antibiotics. So it was we wanted to look deep in, and tried some homeopathic medicine to get something new. And in this method, we included 90 participants. Among them, the 60 participants were diagnosed CSOM patients, and healthy control was 30. Treated with homeopathic medicine, the 40 patients of them, and the placebo control group was 20 with 20 patients. Among the 40 patients of homeopathic group, 17 were selected for Telluria metallicum, and 13 for Mercurius solubilis, and 10 for Calcarea sulfurica. And all of these patients, the patients group and the healthy group, were measured hearing threshold level at 1, 4, 8, and 12 kilohertz, and the otoscopic ear observation was done all of the patients, among all of the patients, participants to be exact. Then selective characteristics of the CSOM patients was for Telluria metallicum, we counted the pungent or the Gallicki order of the pus and tympanic membrane perforation and hearing impairment. For Mercurius solubilis, we counted the yellow thick pus, pain with suppurative eardrum and eustachian tube, and hearing impairment was tinnitus, better on deglutition. Calcarea sulfurica, for these patients, we counted CSM with greenish yellow in color page, occasional balance issue with tinnitus, hearing impairment with a slow tendency to heal. One thing I should clear to you that homeopathic medicine is an individualized medicine. It is very tough to give a group of medicine specifying on a single symptom. So we have to take these 2 or 3 symptoms that is clinico-pathologically common to every patient, and we after giving those medicine, we found that ear suppuration before treatment in tympanic membrane, 17 of them healed after the medication, and this medication was done for 8 weeks, for 8 consecutive weeks. And Calcarea surf, the 10 patients also healed, and Marxol also healed. But the tympanic membrane perforation healed only in 9 patients among the tympanic Telluria metallicum, and 5 patients healed of the Calcarea sulfuricum group. But Marxol didn't show any significant effects on tympanic membrane perforation healing. If you see the images at the right top corner, that this is the perforation 1 and 2. This is all these images are from the Telluria metallicum group. this is one of the patients and the another one. If you see the images, you will find the gradual development of the perforation healing. And the lower part, the homeopathic medicine improve the hearing also. If the top corner, I'm moving the mouse cursor. It is the difference between the healthy control and the disease control. And if you see the difference between the before treatment and after treatment among those three medicines, you'll find that all of the patients developed the hearing impairment in the 1, 4, 8, and 12 kilohertz frequencies. So hearing threshold actually developed all of the among the patients group. And current study actually is a light that shows as light that homeopathic medicine could be used in CSM patients. And we are accepting any further evaluation of these cases. So my conclusion is the CSM patients could be given homeopathic medicine according to the symptom similarity, and there may be a patient will find better result than the other available treatment policies. Thank you. That was my presentation.
Dr. Hussain.
Sir.
So, did you carried out any X-ray of the mastoid process?
No, sir.
How complicated mastoiditis?
No, sir. No, sir. The patients was all the patients were coming to my chambers, and with this apparatus, I go through this diagnosis.
Horoscopy you have done.
Otoscope, yes, digital endoscopic otoscope, and the hearing impairment I counted with a audiometry device.
Because doctor will see sometime also it reappears after some period of treatment.
Yes,
so,
sir. Yes.
What is your observation in that case? Did you confronted in that type of case?
No, sir. The patients who were included in this study were strictly maintaining this sort of criteria that is shown in the Telluda Metallica Marquez, the table of selective characteristics of the CSM patients, and none of the patients was in adverse stage, so that was not included, or that was not counted, sir.
Thank you, madam.
Just a little thing to add. First, because you have a placebo control, so I believe this is a kind of randomization ongoing. Then at that part, so you need to mention about the method of randomization and also concealment. Otherwise, it's not complete. And for the result part, I do not, because you have two control group. One is healthy control, one is disease control. But in the result presentation graphs, I cannot see the treatment versus control.
Oh, actually, healthy control and disease control are there, but the
right. But when you're trying to draw a conclusion about homeopathy, then what we should compare is homeopathy and control, right?
Yeah, this is the control group. The control group is there. The red line symptom of the before 8 weeks. Oh, okay, yeah, actually, I got it.
That is a post-treatment and pre-treatment score. Yes. But what we have to do is homeopathy versus control, right? And besides, at the conclusion, be careful on every word on the conclusion. You mentioned about cost effectiveness.
Yes.
But then throughout the study, there's no comparison of the cost on the different group. So you better not write that down as a conclusion. Otherwise, it would be like very confusing when we read along. Yeah, just a little remark to you.
Thank you, ma'am. Thank you, ma'am.
So I'll call upon the final speaker, Dr. Ashwini, to present her case on scabies.
Yeah, we can see your screen now.
So in pediatric age group, it is a third common skin disease, other being tinea and pyoderma. It's highly prevalent below the 5 years of the age, common in both sexes, and there is a decreasing prevalence with increasing in age. In middle age, scabies was included as one of the 8 known contagious disease of the man. It was very common during First and Second World War, and there was a story about Napoleon Bonaparte lost his victory in war, and the reason was his soldier was suffering from the scabies. When I was posted in the rural area, there was an ashram school behind our hospital, and I observed that there was many students suffering from the scabies with different presentation. Some did not get the scabies is caused by same agent, then why there are different presentation? In our homeopathy philosophy, there is a concept of miasm is given in that miasm is producing agent which are dynamic in nature and which is responsible for different presentation in many diseases. So study was done to understand different clinical presentation of scabies and their miasmatic presentation in pediatric age group. So my study is a retrospective case series study, and purposive sampling technique are done. 60 cases are selected, which has a good data with onset, duration, progress of scabies complaints with the past history of the patient progress with family history. So analysis are more of the scabies are cases found between the age group 3 to 5 years and 12 to 14 years of the age group. Second is the SORA miasm is predominantly found in 60 cases, and other being tubercular miasm. No cases of syphilitic miasms are found. Itching are found in more cases of the SORA miasm predominantly. Papillary and vesical eruptions are predominantly observed in soric miasm. And papillary vesicular pustular eruptions are predominantly observed in psychotic miasm, and papillary vesicular miasm. In the discharges in correlation miasms are discharge found under the miasm, yellowish discharge common under the psychosis, and bloody discharges found in tubercular miasms. More of the cases are found under tubercular miasm with secondary bacterial infection as compared to other miasm. The results are comes. I found different clinical presentations in miasms. Results are given in chart form.
Okay. So with the permission of Chair, Dr. Yonfor and Dr. Niranjan Mohanty, I would like to conclude this session of poster presentation.
Conclude.
Okay. I would like to extend my sincere gratitude to the chairpersons, Dr. Yonfor and Dr. Niranjan Mohanty, for the valuable remarks and comments. Thank you to all the participants and presenters for this great session. Thank you so much.
Hello.
Yes, Dr. Niranjan.
You want that I should talk something? My co-chairperson, madam, and all the moderators and coordinators and all participants and all the speakers. It is understood from this discussion that human knowledge has become unmanageably vast. Each science has been gotten to a dozen or more, each subtler, more complex than the rest. Entire corpus of medical science has split into 1,000 isolated fragments. This is my conclusion. And we have observed that changes are taking place all walks of life all over the world. Any system which is immune to change cannot withstand for a longer period of time. The changing with time and technology is called restructuring. Restructuring is the academic perestroika. Absence of such perestroika will hamper any system. Therefore, I feel we are in the right track. Our youngsters are going very right path. So we happy to see future generation with a glorious future. Thank you.
Hello.
Thank you, sir.
Thank you, Dr. Mahati. And it is a very interesting section, and I want to congratulate all the speakers and on all of your interesting presentations. And as the theme of our section is case reports and RCTs and observational study, I think this kind of a presentation and interaction, I hope this is a chance for all of us to improve ourselves, in fact. And I hope although we do not have time for really detailed comment on every one of you, but I hope that we can improve by reporting our case more properly according to the design. Otherwise, when it goes up to the publication level, this kind of data cannot be used by other or cannot be quoted by other people. And so I hope if it is a case report trial, case report study, follow the home care guideline, use the Monarch criteria. This kind of little step, when we add these little steps together, it would add up to our evidence base and give us more power when we can quote the more quality kind of reporting. If it is an RCT, follow the guidelines as well. You have to report the essential elements so that it is a proper representation from an RCT level. If it is a cohort study, also observational study, if it is a comparison group, please do remember to compare what you want to compare. Otherwise, the aim cannot be concluded, and then the effort would be waste. And I really hope that the presenters and all of us can learn through the process and do better research and have a better reports in the days coming ahead.